when we started this year, 2020, we heard about coronavirus, but we never thought it could change our lives so much. The COVID-19 pandemic is affecting the daily life of all of us. COVID-19 has severely impacted cancer care and the cancer research worldwide. We also have concerns that potential delays in the diagnosis will cause us to have more patients in higher stages. Multiple myeloma patients are highly immunocompromised, so they are vulnerable to infections and the COVID-19 too. In addition, many patients have comorbidities which can increase the risk of coronavirus. How we are managing our multiple myeloma patients? We need to protect these patients from this coronavirus, but we must treat their myeloma. What are the main recommendations? To prevent infection, social distancing, stay home, wear a mask, wash hands frequently, limit contacts. Telemedicine is recommended, phone consultations and or virtual visits whenever possible. Prevention of other infections is also important, for example, influenza vaccinations. Reduce the hospital visits in order to balance efficacy and safety. Use more oral drugs if possible. Dexamethasone doses should be reduced. Switch from twice weekly infusions to once weekly is important. And for it's necessary the treatment adjustments must be made according to individual risks, the institution status, and of course the pandemic local situation. Some general principles include, for young patients eligible for transplant, high-dose therapy and the autologous stem cell transplantation may be delayed in standard risk patients, and induction treatment may be extended. But in high-risk patients, it should be always, if possible, performed as planned. In patients with active high-risk disease, treatment should not be postponed. For elderly patients with newly diagnosed multiple myeloma, the preference should be treatments based on oral administration, balancing efficacy and safety. For relapsed and refractory multiple myeloma, we should treat clinical relapse. It's imperative to control the myeloma disease. I hope we can control the COVID-19 throughout the world and get back to the old normal if possible. Thank you very much.